With technical support from the GIZ, who acts on behalf of the German government in Namibia, the Hospitality Association of Namibia drafted the Occupational Health and Safety Policy for the Namibian tourism hospitality sector. This was done in response to a recent survey that has highlighted the industry's need for health and safety measures for workers in the sector.
Our labour law says quite clearly that all companies should actually have health and safety policies at their workplace, and it was actually shocking for us to realise that not many of our members actually realise that. They all do similar things and the right things very often, but they don't have policies in place. So from the hospitality sector side, we wanted to basically advise our people and give them a document to which they could then measure themselves. A healthy staff is a productive staff, and that's the key element. We want productive and happy staff to work in tourism so that the smile comes easy.
A questionnaire survey among member companies of the Hospitality Association showed that half of all respondents have an occupational and safety policy in place, and even less have formulated an HIV policy or conduct health promotion. More than 40% of the respondent hotel managers admitted to not being familiar with the government's regulation in respect to workplace health and safety protection.
It became crystal clear that our industry focuses all its attention on safety and the well-being of our tourists, and we sometimes forget our staff. Hence the proposal that we actually draft a policy on health and safety in our workplace, in the workplace of tourism, which is a 24/7 business and has certain risks that our staff carries as well. So the policy focuses much more on the working environment for our staff in executing the work that they have to do for tourists. There's not negligence per se, but seemingly from the survey that was done before this policy was drafted, there's a lot of ignorance, and that's what the policy is trying to address, is to work over that ignorance and make people aware of where there are lapses and where an improvement is still possible. And very important is also the communication and the cooperation between management and staff to get it right.
Namibia's HIV infection rate currently stands at about 13% among the Namibian working population. Diseases of the heart, arteries and veins, diabetes and cancer are the most frequent chronic diseases.